Mary-Louise McLaws joins us now from Sydney. Mary-Louise, hi. Thanks so much for joining us here at TRT World, as always. How challenging will be the rollout of the Pfizer vaccine in the US particularly?
It's an enormous country, and of course it has over 300 million people who need vaccination. The first rollout apparently is going to be to 145 sites around the country and 5 major cities. Then they're going to roll out 425 sites, and then another 66 sites in the third rollout. But remember, they want to vaccinate the frontline healthcare workers and, of course, anyone 65 and over who, of course, is vulnerable to dying with COVID. That's going to be an enormous challenge because at the moment, they'll only get about 6.4 million doses. That will cover about 3.2 million healthcare workers in hospitals and aged care. So that's about 12% of their 24 million healthcare workers. And of course, they have about 15% of their population, so about 49 million people who are 65 years and over. And they will need about 100 million doses. So Pfizer will be working very hard 24/7 for many months to be able to cover all healthcare workers, not just the front line, because there's the emergency department, there's pathology, there's intensive care, there's the medical wards, everybody, and of course the elderly.
Right, and what percentage of a population needs to be vaccinated before we start to see numbers of infections falling?
It's a very difficult question to answer because they say that about 95% efficacy for this vaccine. But don't forget that's efficacy for a serious COVID infection. That's just not efficacy to prevent any infection. And that's what we often use to decide how many people in the population will provide herd immunity. So this will provide a certain herd immunity to prevent people from getting serious COVID and dying. So I'd go for 100% of everybody that's over 65 to protect them. But in America, they've got a lot of problems with the Black and Hispanic groups that are truly at risk of poor health. And of course, they can't always access healthcare because they can't afford it because it's terribly expensive. So you'd have to protect them as well because otherwise you'd still be getting death. So it's a very difficult question to answer given that we believe this vaccine just protects against serious. There can still be asymptomatic infection, and we don't know yet whether people with asymptomatic infection can transmit it to others that don't have an elicited response. They may be, of course, at less risk of transmitting it once they're vaccinated, but we don't know any of that yet. So, of course, I'd be looking at covering all elderly, as many Black and Hispanic Americans as possible, and of course all healthcare workers from the front of the hospital to the back, and all aged care. And then of course they have essential workers, which means any truck driver that delivers food, anyone that makes food and grows food. So they have, of course, many hundreds of millions of Americans to cover to ensure that their country continues to work, because at the moment they're in very deep trouble.
Okay, well, at least it's the beginning, a long way ahead. Thanks so much for that, Mary-Louise McLaws,
It is.
WHO advisor, live for us from Sydney.